I'm today going to talk to you about a concept. And this concept, I'm going to say today, you're going to hear it again over the next 10 years, the explosive growth in what I'm about to tell you. We've all heard this morning that the workers' comp medical costs are increasing. And we know that this trend has been going on for many years. We have to say to ourselves that if we want to contain these costs, or even think that we can reverse it, then I'm going to tell you something very simple. We cannot continue to do business as usual. We got to do something big, we got to do something different, and I'm going to tell you what my opinion is. My opinion is the workers' comp industry has to adopt smart technology. Now you might ask yourself, what kind of technology am I talking about? The kind of technology that is in the process of transforming every major industry that touches your life. The kind of technology that is in the process of obliterating multi-billion-dollar companies right in front of your very eyes, and for very good reasons. Now, not long ago, my wife would say to me, "Roz, would you mind going to Blockbuster to get me a video?" And I would get out of my warm jammies, put on my clothes, jump in my cold car, and all while I'm driving, say to myself, I hope that video is there. Well, technology has changed that for us, right? Today, I can just touch a button, and a movie gets streamlined, and even before I even touch the movie, I'm going to say, what does Warren Heck say about this movie? Should I get it or not get it? I can see the recommendations. So, when you look at technology, what it has given us, convenience. I can attest to that. The operational costs are tremendous. You don't have the real estate problems, right? You don't have to rent a place or buy a place. You don't have the storage issue. As you don't have the gas, electric, staff. And the consumer becomes smarter. You can actually see what other people's recommendation. Now, this has touched our music industry. Right now, let's touch a button, we get all the iTunes. This has touched our book business. And now we just have the Kindle. My daughter's 8.5 and she has a Kindle. If you step back and you take an introspective look of what this technology really means, it can be summarized into one word: connectivity. You take a consumer, you take a producer, and you unite them on a single universal platform. What does it give us? Better product for a better price. That's what is going on in industries all around us. Now let's take a moment and look at the biggest industry that is growing the fastest in America. We're going to take a peek at our healthcare. Now I'm an orthopedic surgeon, right? And I can tell you that there is no more fragmented, disconnected, disjointed system than our healthcare. I can tell you that the pricing models to me and to geniuses all around me are very confusing and not transparent. And also, this is something that's true to my heart, is that there's no universal standard way to measure outcomes and to use it effectively. Let me just go into a little bit of detail. How do I, as an orthopedic surgeon, communicate with carriers or with other doctors? Phone, fax, and mail. Now, I can tell you that it's slow, it's expensive, it's manual, and it's unreliable, leading to mistakes and lawsuits. As a provider, what do I want from the carrier? I want to get authorization, I want to check if the claim is open, I want to check if the body part is accepted. The only way I do that today is have my staff get on the phone and try to find that adjuster who's probably out to lunch. What do the carriers want? They want documentation from me. Is this person back to work? Is he not back to work? Can he go back to work? Healthcare information moves slowly and not effectively and not efficiently, which leads to people going back to work slowly, and therefore your debit payments are going up. As far as the pricing care models, I liken it to a Turkish bazaar. Totally not transparent. You cannot go anywhere and find the listing prices of what Stryker or any of these companies pay. I talk to the people at Stryker and say, this prosthesis is $4,000 for Lennox. So I do totally, that's what I do for a living. I put joints. She asked the striker rep, I'm on Lennox Hill, how much that prosthesis costs? $4,000. You go to HSS, $2,000. Why? Why is it the one hospital gets a completely different price than the second hospital? And I'll tell you, we're going to do a little game now. We're going to name that price. So someone has an L4, L5 fusion in New Jersey, right? So the question is, isn't it cost $20,000 or $100,000? Here's the beautiful thing about being a carrier. It must be a lot of fun. You open an envelope, see Dr. Winiarsky did a spine surgery. What's it going to say? 20,000? 40? Who knows? It depends upon which network I belong to. It depends where I got the implant. The facility, am I in that network? And which bill review company I use. The problem is that for the same surgery, by the same surgeon, you have no idea what the price is going to be. And something again that I speak about is that I think it's very important to have some effective data bank on success rates, right? So if you want to do an L4-5 fusion, let's say Dr. A has 99% success rate. Dr. B's got 50. Dr. A's got an infection rate. As a carrier, in 22 states in America, you can direct care. Why not direct it to the guys that have the best outcomes? So what you need is a universal, standard way to measure outcomes and use it effectively. So as a very quick recap, we currently deal in 1980 technology, the phone, the fax, and the mail. I call that, as a measuring tool, low grade of connectivity. The networks, and I want to talk about intermediaries. The workman's comp is better than most healthcare systems for the following reasons. There are intermediaries. For example, the nurses come to my office and say, doctor, can this person go back to work? And they'll get the information to me. But they actually have to send a nurse into my office, and there's a price to that. Or you have all these networks out there that push information around, and they do, as Ken said, a good job. But you know what? They work with phone, fax, and mail. That's how they work. The question is, the future is where we have to be, and that's the highest level of connectivity, where there's real-time data exchange, where you can make appointments online. I mean, it's going to be the future. You want to make an appointment with a doctor? Here. Take your smartphone, touch a button, you see a doctor's schedule, make an appointment. You want to get a report, touch a button, and get your appointment. That's what the future of medicine has to be. And additionally, if you want to see the doctor's outcomes, everything will be online. So, I am the medical director of SWIMA. Our mission is exactly what everyone in this room would want for yourself. That is access to the best doctors with the best outcomes. We entered the industry in radiology. We built a platform, a real-time connected platform between doctors, diagnostic centers, payers, and the patients. Our philosophy is very simple, and that is, if you take the ability to move healthcare information around efficiently, combined with the best doctors, our goals are to get patients healthier faster, and do it with less administrative costs, leaving more room and money on the table for both the providers and the carriers. So I'm going to leave you with a note, and I want you to remember this because I think it's important, and that is connectivity and other industries have left with us with a better product for a better price. We can do the same thing in medicine. That's it.
Thank you, Doctor. Our last speaker, it is